Doug, Mary, and John all face the danger of a stroke. In 8 out of 10 cases, there are warning signs, danger signals that a stroke can soon occur. You should be able to recognize these warning signs. They can save you from having a crippling or fatal stroke. What causes a stroke? A stroke occurs when something interferes with the blood supply to a part of the brain. Most strokes are caused by atherosclerosis. Here's how. The blood is distributed throughout the brain by a network of arteries, which branch again and again until every cell is reached. Atherosclerosis can slowly and silently obstruct an artery that supplies blood to a part of the brain. As we age, fatty streaks appear in the walls of the arteries. These are normal and harmless. In some people, as they grow older, the fatty streaks change in appearance. They grow larger and penetrate into the wall of the artery. Substances in the blood, such as platelets, begin to build up in this area and slow down the blood flow. This can continue until the artery becomes completely blocked. This shuts off the blood supply. Without the oxygen and nourishment that the blood supplies, the brain tissue around the area is quickly damaged, and some cells die. This is the most common form of stroke. In 1 out of 5 cases, a stroke is caused by a rupture in the wall of an artery that releases blood into the brain. This sudden release of blood at high pressure destroys the surrounding brain tissue. Another cause of stroke may be blocked arteries outside the brain. If any of the arteries that supply blood to the brain should become blocked, such as a blocked artery in the neck, the decreased blood flow could damage nerve cells in the brain. When a stroke happens, it can cause physical and mental symptoms, such as loss of speech, vision, memory, or paralysis. Often, people have symptoms that come and go, symptoms similar to those associated with stroke. The blood supply to the brain is cut off or slowed down temporarily. The affected part of the brain soon returns to normal, and the symptoms disappear. Only a few cells are permanently damaged. Doctors call these symptoms that come and go transient ischemic attacks, or TIA. They're called transient because they last only a short time, usually only a few seconds or minutes, always less than 24 hours. They're called ischemic because there is a temporary insufficiency of the blood supply to the brain. Mary, for example, suddenly experienced extreme weakness in her right arm and leg.
Now it feels numb. What should I do?
John's difficulty appeared during a meeting.
You think they could handle this one for us? What do you think of them? John?
He suddenly couldn't remember what they'd been talking about. And when he tried to speak, the words just wouldn't come.
John? Are you all right, John?
Fine.
Okay.
You mind repeating it for me?
It lasted only a few seconds. But this wasn't the first time he had had a TIA. He had had similar sensations before. But there are some people who receive no warning signs of a stroke. In Doug's case, detection came as a result of a routine physical checkup.
Mr. Anderson, the findings on examination indicate that you have some narrowing of the vessels in your neck that supply your brain, and that these are a warning of the probability of a stroke.
Everyone should know and be able to recognize transient ischemic attacks, TIAs, the warning signals of stroke. They include weakness, numbness or loss of sensation of one limb, or of both limbs on the same side, or on one side of the face, mouth, or tongue, or difficulty in speaking.
No.
Writing. Understanding speech.
I'm sorry, I didn't catch that. Would you mind repeating that?
Dizziness, unsteadiness, or fainting. Complete or partial loss of vision in one or both eyes. Blurred or double vision. Or a combination of any of these symptoms. Never ignore any of these warning signs. At any moment, a blood clot may form at the site of the obstruction, cutting off the flow of blood entirely. When this happens, it causes lasting damage, and many brain cells are permanently destroyed. That is why, whenever there is evidence of a narrowing of an artery, immediate steps must be taken to prevent a full-fledged stroke. Here, the patient can be very helpful.
About how long did that last?
Well, just maybe 3 minutes or something like that.
And have you ever had anything like this before?
Oh, maybe a couple times, but
In addition, more specialized studies may be conducted using a variety of advanced techniques for pinpointing circulatory problems.
This will be dependent upon further studies in the hospital.
When an obstruction has been located, the physician must determine the best method of treatment. This may include either special medication or surgery, depending on the location and extent of the obstruction. The best method of lowering your risk of a stroke is to decrease your chances of developing atherosclerosis. If any of the following risk factors apply to you, you are likely to have a higher than average risk of a stroke. A major risk factor is a previous history of heart disease. Hypertension or high blood pressure is another risk factor. Obesity, which often leads to high blood pressure, is a contributing factor. If you have diabetes, it can increase your risk of a stroke. Abnormally high levels of cholesterol or fats in the blood and other blood abnormalities can increase the likelihood of a stroke. Smoking and lack of exercise are two other indirect factors that increase the chance of stroke. In most cases, your doctor can prescribe a program for your management of these diseases or conditions. This may consist of a special diet or exercise program, or specific medication. It was once thought that strokes were inevitable. Now we know that most strokes can be prevented if the underlying cause is found and treated in time.
Well, I guess I feel some relief, Doctor, that I did come in time and that something could be done or can be done about my condition.
The responsibility is yours. Never ignore any of the warning signs of stroke, because 60 to 80% of those who do go on to have a stroke within 5 years.
What do you think?
It sounds good. Let me think it over, Norman. I have an important call I have to make right now.
Oh, all right. I'll see you, John.
Stroke is much too serious to take chances with. Anything you can do to prevent it is well worth the effort.
Dr. Robertson's office, please. Yes, this is John Davis. I'd like to make an appointment with the doctor as soon as possible. Well, I'm having some problems with my speech and my concentration. 9 tomorrow morning? That's fine. Thank you very much.